Hey guys, so next we're going to talk about seizure disorders. So again, I'm going to try to focus more so on my notes that I have. So with seizures, so as you learned in pathophysiology, these are abnormal, sudden, excessive discharge of electrical activity within the brain. So epilepsy is a disorder characterized by chronic seizure activity reoccurring, and it indicates brain or CNS irritation. So it can accompany other disorders or occur spontaneously without apparent cause. There are some genetic factors as well as well as metabolic disorders, infections that can occur with seizures. So with a metabolic disturbance, it's associated with seizures. It can include acidosis, electrolyte imbalances such as hyperkalemia, alcohol or barbiturate withdrawal. Pentobarbital is used for sedation or a coma. So I'm going to skip over extracranial disorders associated with seizures. You can read that, as well as the next slide. So with epilepsy, this is the fourth most common neurologic disorder. People with Alzheimer's disease or who have had a stroke are at a higher risk for developing epilepsy. It's also higher in children, young children, as well as older adults, more common in African Americans, and it's more common in males. So I'm going to skip through the etiology and pathophys. You guys can read through those. And as well as with epilepsy, the cause is unclear. So I'm going to the slide with the etiology and pathophys of epilepsy, where it says changes in functioning of astrocytes may play several key roles in reoccurring seizures. So astrocytes, those are the most numerous cell type within the central nervous system. And it provides neurons with nutrients, controls the blood-brain barrier as well as the blood flow. So they play a key role in brain function. Astrocytes, these release glutamate, which is a neurotransmitter that triggers synchronous firing of the neurons. Drug therapy typically focuses on suppressing these astrocytes, signaling, or it decreases the release of glutamate as well. I mentioned that there is a genetic link. Some types of epilepsy run in families, but many are acquired at birth rather than inherited through mother or father. Other types of IgE are related to abnormalities in specific genes that control the flow of ions in and out of the cells and regulate neuron signaling. So some clinical manifestations, there's two major classes of seizures. There's generalized, and generalized, this involves both hemispheres of the brain and characterized by bilateral synchronous epileptic discharges in the brain from the onset of the seizure. You could have a brief or altered level of consciousness with this. Focal seizures, these are formerly known as partial. It involves only one hemisphere of the brain. So an example of this type of seizure is the patient that reports feeling numbness, tingling of the left arm before experiencing a seizure, because again, it only involves the one hemisphere. So on the next page, the algorithm of seizures. So this is a good chart just to have in front of you. You might want to scribble a few notes when you're going through your review sheet on this as well. So you have different phases with seizures. The prodromal phase, this is with sensations or behavior changes that precede a seizure. An oral phase, this is with a sensory warning that is similar each time a seizure occurs. The ictal phase, this is from first symptoms to the end of seizure activity. And the postictal phase, this is the recovery period after the seizure. So you have, with generalized seizures, the tonic-clonic. So this is characterized by loss of consciousness and falling. So the body stiffens, and that's the tonic, with subsequent jerking, which is pretty rapid, and the extremities are clonic. You also see where it says cyanosis, excessive salivation, and tongue or cheek biting may occur. Patients may also lose their bowel or bladder control sometimes. The duration of this can be anywhere from 1 to 3 minutes. So when a patient falls, they should be placed in the left lateral position. And the reason why is because this reduces the risk of aspiration. And nothing should be inserted into a client's mouth during a seizure. In the post-ictal period, some clients may require suctioning, administration of oxygen, or airway positioning or maintenance. So with typical absence seizures, this usually occurs only in children, rarely beyond adolescence. This can also cease as the child matures. It can be precipitated by flashing lights and hyperventilation. And often the child is typically it's noted in the classroom. Frequently, teachers may point out to parents that the child suddenly stares into space. So actually, it can be thought of as more of a behavior issue as opposed to a seizure. So it can be missed. So typical absence seizures, daydreaming. This lasts only a few seconds, up to 20 seconds. And like I said, it often goes unnoticed. Teachers typically report this as a behavior disorder. And typically on an EEG, you see a spike in the wave pattern. And it can occur up to 100 times per day when untreated. Atypical absence seizure, staring spells, eye blinking, and so on. And that can continue into adulthood. So moving on to myoclonic seizures, and this is characterized by sudden excessive jerk or twitch of body and extremities. So the jerk can be forceful enough to cause the patient to fall. So, if you experience this, you're present, you have a patient this happens to, you want to make sure that you check the patient's head for injury. And this typically only lasts for a few seconds. So with an actinic seizure, begins suddenly and a person falls typically to the ground, lasts less than 15 seconds. Again, there's a great risk for a head injury. Some patients also have to wear protective helmets as well. Tonic seizures, this involves sudden onset of maintained increased tone in the extensor muscles. So the patient is typically stiff. It lasts less than 20 seconds. Moving on to focal seizures. So typically with this, the person is alert, or consciousness can be altered. Typically what you see with motor are parts of the body are jerking, or they have automatic hand movements. Sensory, they may hear ringing, feel like they're floating in space, possible visual hallucinations. Autonomic, elevated heart rate, the breathing may change, the patient may experience some sweating. Psychic, suddenly feels emotions of fear, depression, maybe they're happy. So focal seizures, they're divided into simple or complex. So again, with simple, the person remains conscious and alert. You see those feelings of joy and anger. With complex focal seizures, patients have loss of consciousness or alteration in awareness. So this produces a dreamlike experience. So during a seizure, some people may do things that can be dangerous or embarrassing, such as walking into traffic or removing their clothes. These patients need to take precautions before a seizure occurs. This usually lasts between 30 seconds up to 2 minutes. But again, these patients, they typically have strange behaviors. You may notice that they might start smacking their lips together. So with focal seizures, any tonic-clonic seizure preceded by aura or warning is a focal seizure in nature, or they may spread to involve the entire brain. I want to talk about status epilepticus. This is a state of continuous seizure activity or condition when seizures reoccur in rapid succession without return to consciousness between seizures. So any seizure lasting greater than 5 minutes. So the longer the seizure lasts, the less likely it is to stop it without drug therapy. Neurologic emergency, highest incidence is in children and older adults. Permanent brain damage can result because neurons cease to function. So complications of seizures, sudden, unexplained, or unexpected death in epilepsy, that's abbreviated as SUDEP. So sudden, unexplained, or unexpected death in epilepsy is higher in males. Also, people taking multiple anti-seizure drugs and patients with long-standing epilepsy who have poorly managed seizure activity. The direct cause is unknown. So patient teaching, you really need to educate your patient that they need to adhere to their medication. Other complications of seizures could be depression, financial costs of medications. Parents of patients may have to take off work for this. Driving signatures as well. Patients might not be allowed to drive, so they have to find alternative transportation. So with diagnostic studies of seizures, acute comprehensive description of seizures and health history. So obviously you want to do a history and physical exam, look at the patient's developmental history, any significant illness or injury, family history. Does the patient have fevers with seizures? You also want to do a neurological assessment. When you ask about seizure history, ask about precipitating factors. Have the patient give you a description of the seizure, any previous diagnostic studies, management of their drugs, have they had any surgery? The magnetoencephalography in conjunction with the EEG that has a greater sensitivity. Other things that you would want to check is a CBC, a white count for infection, as well as serum chemistries, liver and kidney function, as well as a urinalysis. A patient can have a CT or an MRI done to rule out structural lesions. So I'm going to skip through some of this here. I want to discuss interprofessional care, primary drugs for treatment of generalized tonic-clonic and focal seizures. A common one is Dilantin or phenytoin. Carbamazepine, Tegretol. You want to educate your patient not to take this with grapefruit juice. Report any visual abnormalities. Abrupt withdrawal after long-term use may precipitate seizures. Patients should never abruptly stop taking any seizure medications without consulting their primary care provider. If weaning does occur, the patient is typically seizure-free for 2 to 5 years and have normal neurological examination and EEG. So, treatment of status epilepticus tonic-clonic seizures. This requires initially rapid-acting IV lorazepam or Ativan or diazepam or Valium. These are short-acting drugs. Their administration is followed with long-standing drugs such as phenytoin or phenobarbital. And of course, you can give the Ativan or Valium IV. Just make sure that your patient is not allergic to one of these medications. So I wanted to discuss some common side effects involving the CNS that include diplopia, which is double vision, drowsiness, ataxia, and mental slowing. So what is ataxia? So this is the loss of full control of bodily movements. So the patient may appear drunk. And some things that you need to know, some side effects of phentoin. Patients have gingival hyperplasia. So one thing that you want to do is assess your patient's mouth. They also may have some tenderness, bleeding, hirsutism, that's when you grow hair. The patient also should make a dental appointment a week after starting this medication, phentoin. So you want to make sure that you promote good dental hygiene, flossing, toothbrushing as well. So some other things that I want to discuss under gerontologic considerations. So with phentoin, that's metabolized in the liver, and it should be avoided in older adults with compromised liver function testing. So obviously the first thing that you would want to look at before the patient is placed on this drug is baseline liver function tests. Okay, and I'm just going to skip through my notes a little bit here. I want to talk about a vagal nerve stimulation. This is an adjunct to medications when surgery is not feasible. So the exact mechanism is not known, but it is thought to interrupt the synchronization of epileptic brain wave activity, and it stops excessive discharge of neurons. So an electrode is implanted in the neck, and it delivers electrical impulses to the vagus nerve. So the patient activates it with a magnet when he or she senses seizure activity. So the nurse typically instructs the client to hold a specialized handheld magnet over the implantable device when the aura occurs. So it lessens the severity and the duration of the seizure that will follow. So as with diet, ketogenic diet has been effective in controlling seizures. That's your high-fat, low-carb diet. So typically meals must be carefully planned because the amount of protein and carbs in the diet may need to be restricted. So I'm going to skip through this. I'm passing nursing assessment. I think that's something that you guys can watch over or look over. So where it says nursing implementation, ambulatory care, it's good for patients to use medical alert bracelets. Teenagers, they do not always want to wear these, so suggest to them to select something similar to those worn by their peers. Dress that bracelet up a little bit. And I think that's it for the discussion. So of course, next week you guys have a test on Friday. It starts at 9 a.m. So you want to be on Blackboard at that time. If you have any questions in the meantime, let me know. Just shoot me an email. And also as well, I will put together a group of questions that I mentioned for some bonus since our documentary was canceled. Thanks.